We brought in Uncle go say hi to viewers and listeners out there.
Viewers, good evening.
They don't know that they talk.
Mina Dr. Abdul Jalloh, Mina a psychiatrist, and I work at the Sierra Leone Psychiatric Teaching Hospital.
Okay. Dr. Jalloh, nice to get you right here, and I appreciate you come. You can just give a little bit background about yourself, because I know say before you come, we know Dr. Nahim. I remember sometime when I've been there, I think I've been talking to Dr. Nahim sometime, and I know saying a late man now, may soul rest in peace. Can you just give a little bit background about yourself and how you come into this profession?
Yeah, it's a long story, but I will try to make it short.
Exactly.
And everything starts when we be the fourth year in our medical school.
Okay.
Because every fourth year, they can send medical students there on postings. So they sent me at the Kisi Psychiatric Hospital.
Okay.
For 2 weeks. I go there, I see, by then the things they will be happy there, it's very discouraging.
Okay.
And nobody no go ever want for go work there,
okay,
or for make even enemy go admit there.
All right.
So I go there, I got moved, and come back, think over, I say, now one person number for a population of over 7 million people, and the late man, he don't retire by then, he be just the help. I mean, a person way very emotional somehow.
Okay.
Yeah, and I don't foresee somebody to suffer. So I come back to class. Now I tell my colleagues, I say I think say they do psychiatry. They be facing a phone. Luckily again, we get some team of experts that will come out UK come.
All right.
Because the Dr. Nahim create some kind connection with one NHS in the UK. So they come, then they give lectures on psychiatry. So that's it. Waiting people that they tell me about mental health and waiting people that they tell me a different. No?
Okay.
So after the lectures, I meet there. I say I'm interested in mental health, and they say, "Wow." I say, "Okay." So since then now.
Now, be you one going for that, or your other colleagues away?
Now be me one grade.
All right.
Yeah, yeah. So we start, and 50 year come. 50 year they can allow for go out for 6 weeks for do what we call medical electives. That's not for
get used to the job,
exposure.
Yeah.
Let's say that. So now I go UK. I go do my electives now the Princess of Wales Hospital in Wales.
Okay.
I did it for 6 weeks. I rotate now all the psychiatric
hospital there.
Not to the hospital there. All the psychiatric MS specialties there.
Okay.
Because we get different ones. We get child, adult, forensic, lazy, or all that. So I rotate on each one of them, just for make I get different perception and expose myself to exactly what I want to do.
All right.
Since then, anytime I go UK, I make sure say I attach myself to
your own place indeed.
To a hospital, a psychiatric hospital, either it be community-based mental health or forensic, anyone. But I make sure say I attach myself because I don't develop this network of experts of consultants in the UK. So anytime where they go, I cannot inform them that they come, but I go and spend certain time during me holidays.
Okay.
So after I do my housemanship, I go to ministry. I tell her say for me they post me in the psych hospital.
Okay.
So I began work there October 2011. Because why I say for me they send me there because I want to use the opportunity for make a study exactly what are the challenges and the place.
Okay.
Then for make I able understand the staff the challenges and the needs.
Okay.
I did it, but it was not easy, honestly. You know, I'm a salon a place. I don't know. They can always try to discourage young people.
All right.
Yeah. But I persevere, I push, I lock my ace, because I know which I need in my life, yes. So, 2012, I before go Ghana for go do this psychiatry. But go ministry, they say no funding, no day. Imagine, you know, the only person by then don't retire. Then there is somebody who is willing, who is motivated, we want to go do this cause. They say no way.
Nothing.
Okay, I see that because one doctor be there, Dr. Goodin, he be to create the link call for me for Ghana for my cause, but it not happen. And no say God
because of the fund.
Yes, the fund. But me think I say God get a reason. Right?
All right.
Then 2012.
Okay.
One conference be there in Cape Town, South Africa. I go there. Now I go meet one professor in Kenya, and just this networking no more. Meet her, tell them waiting on my intention. I ask me to come out, I tell us in Sierra Leone.
Okay.
Yes, I say well I want to do psychiatry, blah blah blah. I say okay. In fact, now day, I say make us send you all my document, my credentials.
Details.
Yes, and thank God I'll be get with me.
All right.
Now again. So I say make her keep in touch with them. That few time we made a man meet, it's like we don't know ourselves for years.
Quick.
Yes. It took me like in Peking.
All right.
Yeah. So I come back the 2013, night sending me the link, say application open for make her apply. So I apply, but guess what? When I apply, I tell my colleagues also. They say apply. About 5 weeks ago that year.
For Sierra Leone or for Cape Town? What's that for apply for?
Kenya.
Okay.
Kenya.
All right.
Yes.
Because Kenya, but now go meet up in Cape Town.
Yes, yes,
okay.
yes. Kenya.
So now apply for go work in Kenya?
For go study.
Okay, study.
Study, yes.
All right.
Yes. So when we go, we apply. Now that part I pay for we all application fees.
Wow. How many of you now?
I think about 5 or so.
From Sierra Leone?
From Sierra Leone, we go that particular year there. I pay for we all the application fees. Then they conduct interview for we online. Some of we now will go and they conduct interview. I think that was it was a reason why God make I go Kenya. Because when I go there and the exposure I get, I don't regret it at all.
Okay.
I was really exposed to renowned psychiatrists there all over the world. I don't meet most of them.
Okay.
The part take me like in Peking, and up to date, me in the communicate. So, we done 2016. I come back immediately. But while I be there Kenya, I be there make sure say, of course, the department exposed me for attend conferences there, international conferences there, meet
more
people.
Links.
Yes.
More network.
Yes, more network, and you did. So, part of my training in Kenya is I for spend some time in a recognized or established psychiatric institution.
Okay.
So I apply for going to the Institute of Psychiatry psychology, so-called the IOPP,
Okay.
and now UK, where they part of King's College and the Mosley Hospital.
Okay.
So I go there. I be there. I rotate almost all side again. I rotate now all.
So more exposure.
Yes, I make sure say I go now all the mental health facilities there in London. I go all. What's it all? I go everywhere.
Okay.
I spend time with it.
So still on the training for Kanwoke?
Yes, just for make I get skills,
Experience
knowledge,
and all that
experience,
kind
and
of
come.
Yeah.
So I done the. I go back Kenya. I also established more network again. I done to 2016. I come immediately. I done. I come.
Okay.
I come. Same challenges again.
What about the other colleagues and outside them in there at that time?
Now we all come.
Okay.
Now we all done.
Okay.
Yes, we come. Yeah, we get internal medicine. About 3 weeks ago, that time we get neurosurgeon. We get obstetrics and gynecologists. Then even the current deputy minister too of health too.
No, all been there.
Now all be there.
Wow.
Yes. So come back. They post me for go taking charge of the hospital now.
Okay. Nakisi.
Nakisi.
All right.
I go there, challenges, and I start for work there to 2017, January 3rd or so. Yeah, it not be easy. Patients they be on chains, medication problem, the manpower not be there. They be chain people in the hospital because of 2 things: the manpower will not be there, and the lack of medication.
All right.
So I think that be the reason why they change people there, because we person violence, it's very risky.
Yeah.
Either to the person
Or to the people around.
or to the people around.
Yeah.
So now that make they be the change. So we try for implement certain approaches there, interventions in the hospital.
Yeah.
In we only 2 ways for clean the hospital, the staff there, they clean, everybody, the staff there. Thank God I meet a staff way very motivated, we gets passion for
The job.
the job. So they make things easy, and they really get high respect for me.
Okay.
So I think now that they helped me greatly.
All right.
Yeah. So November 2017, we were my senior colleague, Dr. Babalo Barry. Like called me. And I say, they get some guests there. Where they come from UK.
Okay.
US for come work in a salon. But they want go na the
Psychiatric.
no na the PPCMH.
Okay.
But
Cottage.
yes, but even come then the hospital.
All right.
That's a good doc. They come. Thank God among them we be getting a psychologist.
Okay.
They come, they all come. The soul of Dr. Paul
Right.
Farmer rest in peace.
All right.
Because now I'm one of the co-founders of Partners in Health.
All right.
They come. Of course, I tell everything, the conditions who they work on, take them around the hospital. They say yes. In we own little ways, we don't
Doing the best.
we best. So make you always tell people they say, no wait for make person come help you. You try for help yourself.
Okay.
Without it, if person comes to say yes, you don't try, you don't start,
Go help you.
you go help for
When I
push
say
you.
what I say for call
Yes,
back.
yes. So they come, they see yes, we they try with the small resources who they get from Ministry of Health, from government. Of course, mental health issues or mental health challenges is the same worldwide. The priority given to mental health is very low.
Okay.
Now, during this COVID, Nahim, priority has been given to mental health issues.
Alright.
Yes. So they come, them CC, we dey try our best. They were touched. Anyways, they were touched.
Okay.
Yes. So they go,
Mm-hmm.
now they tell me, say, they are moved, and they go support me.
All right.
And indeed. That same month day, I began for travel with the I began for go UK. That's in the back. So at the UK now they call me, say they want to talk to me. That's in now Sky, Sky BD.
Okay.
Yes. So that's okay. So that was the first call. From the first call, we get a plan, short term, middle term, and long term.
Okay.
So, and one of the short terms that we get for the patient care, medication, water supply, electricity, for making the place
Clean, sanitary.
clean, sanitary, yes. And indeed, it happened
Okay.
within a few months.
All right. So, Dr. Jalloh, like I say before, when you can there, of course, and I've been meet you now recently, I able meet you and decide for call you. But the way with everybody hospital, there's a different now than they see on social media. So, what you take now, the funding, and you in particular must make a difference, really. But what you take for make it turn around at the psychiatric hospital? Because first of all, they hear about Chris Yard, where all of a sudden they change and say no, they know what they call on Chris Yard.
Yeah, just the kind of start. You can forget the mindset for change.
Okay.
And when they get a mindset for bring a change, if you make sure say you self don't change in terms of your thinking, your perception don't change. And if you try for even bring along people there,
Okay.
teamwork is key. Collaboration. You can't do it alone.
Not possible.
You can't do it alone.
All right.
So I think saying now that it greatly helped me, and the Ministry of Health, they create that conducive working environment for me.
All right.
Because some the decisions that they will be take, like for especially say Solomon was stubborn for change way for change way of thinking.
Exactly.
It's difficult.
All right.
So if you not get that support at the highest level, because you want disciplined person,
Other people, they don't want that.
they don't want that they go come out because instances that they
You're right.
where some staff they go report me in the ministry, and some even go na some even hire some journalists there
To write bad things about you.
for blackmail me.
Okay.
All that today. But since I began the support of the minister, the CMO, the leadership, I'll be able.
All right.
Yes.
So the whole country, now just you no more a doctor when they do that because we know the area about psychiatric hospital now. Bo, Mama, can we meeting say if for decentralized or now you want green?
Now one hospital we get.
The whole country.
The whole country.
What do you think about that?
Well, a good and not good.
What's one of the good part of it?
The good part is the current trend in terms of mental health care. It's community based, and and now is that we try to integrate mental health care delivery into other healthcare services
Okay.
or programs. Like for example, more get small units there. Now the hospitals like
Exactly.
Connaught,
Exactly.
now the district hospitals there, the PHUs there get small units there for able manage common mental health conditions there.
So isn't a mental health? Sorry for cut you off. Wouldn't a mental health?
Well, for the layman, mental health not the way we think, we feel, and act, we conform to society. We want to make we able to contribute to the development of the nation and able to manage stress. So it's basically the psychological, mental, and social well-being per se.
Wouldn't that maybe okay, go ahead. Because I'm saying that the signs or symptoms we go say this person gets mental issue because we don't see people on the streets where the ordinary man they say this is a crazy man. You go see some a wild, some not wild, some dirty, some quiet. So you can able explain that a little bit?
Yeah, it depends on the type of mental health condition we
So
get.
which type of which conditions in there?
So we get different types there.
How many? So
Just like I get different type of physical conditions there.
Okay.
Hypertension, diabetes, this. That's what we still get there. Yeah.
So the mental part of it, which one?
We get the psychotic disorders there. Where psychotic disorder basically now person gets distortion, the distortion in terms of inability for think or for act. For example, you go they behave abnormally, you go they hear voices or see things there we call hallucinations.
Okay.
Or sometimes he will get this false belief. Say people that they are against her, or people that want her, or say they suspect people always, or sometimes he get this self belief, say in a God, in a president in Peking, or in a, he just get that self what is it for say he gets supernatural powers for make things happen. So we get different types of hallucinations, we get different types of delusions there.
So they want to know this in the streets. Now which category you go put there? Which they want to know this in the streets, so we see it all over the streets.
Those are I'm not going to say they get mental health conditions until I assess them.
Okay.
I go say,
but what you say about
they are destitute.
You know, Salomon, we at this Christmas, it totes bundle, you know, they make dirty, they gonna run. I mean, some of them okay, even you're using a Christian, then come out, or Christian don't fool, then pull them back. What do you think?
Yeah. Professionally and ethically, I'm not going to just see person in the streets and say Chris. I have to assess the person.
So then people know this in the streets.
They are vagrant like.
Okay.
Yeah. So now if you want for me and know if you get mental health problem, you counter to me, I assess them.
Okay.
But for see person will tell you say you crazy now.
So when at the stage you saw somebody they go through away, people who they watch you now go say, okay, like this person gonna, I mean, this psychiatric hospital. Is it that, I mean, if you look out, then, I mean, symptoms of science we don't mention, so you see them, it's like there is something, like they allow, then they chase them, they decide for Congo, then, which step will they use? Because before now, I don't know if you said, you don't know which would they, because we never gonna do home, you don't hear that, we're gonna, I mean, for example, for the other man for overstand, Christian and then they give boss kit for go get water. If you see go get water or the boss kit, that means say you crazy because if I don't say the kit will boss.
That's what they say. But what you want to make clear is nobody not exempt for get a mental health issue.
I think you hear from me preamble what start like what I mentioned that.
Nobody not exempt.
But maybe the category day, or the level.
Yes, level day, and it depends, just like how the definition of mental health. If you're able to withstand stress, different type of stress.
It's a mental issue.
That's one. Two, if you're able to contribute to the development of your community, your nation.
So you want to say idle and say mental health?
So mental illness is now person able to function well in a society.
Okay.
Able for be productive. For example, this person don't use for go work in the morning, a very hardworking, they deliver, then suddenly a stop.
Okay.
Big issue and work.
Okay.
A lost interest for go work. So they are coming the mental health issue now, where that person they need help. So for the mental health conditions, they will get common one way where they are around way, like depression.
You're right.
A very common, a very common.
What's that depression?
The depression now mostly we would say poor lads.
Something the money or whatever.
Poor lads. That means it becomes sad always. Them actually lost interest in things that we don't use for enjoy.
Okay.
You know, possibly we don't use for go work every day. But when the depression come in, you stop for go work. You lost interest totally.
Okay.
And back maybe you oversleep or they sleep. you overeat or you know they eat, it becomes
So
yes
imbalance in
yes,
between.
in between.
Okay, doctor, what you could say again? I mean, like I say, I want to put in a way on context in Sierra Leone. You got a good me say you get some family the way, then go say, ah, this is not swear, then swear and make you crazy so. Well, some people not believe in Dandy. Whilst in the African context, people go say, ah, well, this family swear. I mean, it can lead to mental health, or is it possible then say this person a swear and they crazy or get mental issue?
I think another thing that they bring about the stigma towards mental health issues, conditions there, because of the tagging, the cultural beliefs. Say na do the person, na fangia.
Exactly.
Swear, na granny go up in pots na bush.
Exactly.
So mental health conditions, they are real. It's real. It happen. Just like I get hypertension.
Then say they can lead to
or
the stigma can lead to that.
No. Yeah,
you not believe in Dandy?
Me?
Yeah, for say then swear person they Chris?
Me? No.
Okay.
No. No. It's a health condition.
All right.
Yes, we get something to do with you brain. Chemicals in your brain where they become imbalanced.
All right.
Where they become imbalanced, you're not able to function again how you function.
Okay.
Then someday it can run through the family. Hereditary, genetic. Then I will get issues there where they happen at the wall. Financial, poverty, unemployment. Now drugs coming. All if you consider what up in a salon, the 11-year civil war, the aftermath of that one day,
the corona,
Ebola, mudslide, flooding, all that today. So all that today they come in for trigger a mental health issue.
Okay. So like I asked earlier on, people away when they get into the homes, how are they able, I mean, do a test or maybe a counseling for know whether they get mental issue or not, so when I go admit at the hospital?
Well, that make you go do the course, you for be trained and certified as a psychiatrist for make you able.
So how are you doing the kissy mental?
Well, we get of course just like any doctor, they take history. We depend more on history taking.
Okay.
On history taking, and also called mental state examination. We can do that test there, just maybe for confirm or for rule out. What we call organic causes there. Yes, but basically we depend more on history. Now that make when we see patients, we spend time with one patient. Like 45 minutes, 1 hour, 2 hours, it depends.
Okay.
Because really because we got what to call the biopsychosocial model of treatment. We go for delve more into the social aspects.
Okay.
Housing, employment, family, everything about the social, because social issues now one of the major factors that we can trigger mental health issues.
Okay. What about peer group and that kind of stuff?
Yeah, peer group it's more of drugs, for abuse drugs.
Okay. Yeah. All right. So we go get for can watch the new home, but I want to watch this clip quick. Hope me producer will get some. They talk about some substance where young people they take. Maybe from there now we'll come and talk about the new place where then they open. But let's see if we producer get that video there. Let's just watch about 1 minute quickly. Then we'll come back. Stay tuned.
A few puffs is all it takes to end up in a trance-like state for up to an hour. The drug is called Kush, a potent mix of chemicals that mimics cannabis. In this smoke-filled room in a shanty town, young Sierra Leoneans have gathered to get their fix. Many are barely in their teens. At around 25 US cents a dose, it's a cheap and easy way to escape reality. In the past few years, Kush has wreaked havoc on the lives of many young people in Sierra Leone.
They say I have to purge my body of this substance. Since I started smoking 5 years ago, my body is now addicted to this thing. I have to buy medication, but I don't have the ability to wean myself off it, so it's difficult for me.
Ibrahim Karoma is a social worker. He thinks Kush is one of the most pressing issues facing the young people he works with. He often visits the hideouts where smokers meet up. On this day, Ibrahim speaks to around 100 addicts about the dangers of Kush.
Because young people are dying. Young people are dying. We need a speedy and refocused strategy to see how young people are taken from this drug intake. But at the moment, it is quite alarming.
In the face of a mounting crisis, the country's only psychiatric hospital is overrun with addicts brought in by their loved ones, hoping to get them clean.
What we see in the hospital can be likened to the tip of an iceberg, where only the severe cases are being brought. But if you go down to the communities, if you go down to the parks, you go down to the streets, you go down to the ghettos, you'll find much more, people using these substances and the impact has been created on them than what we see here.
But in the face of a highly addictive drug, willpower is not always enough for those being discharged. As resources for follow-up support remain low, relapse rates remain high.
No more Kush, no more Kush.
All right, welcome back. And yes, Dr. Jalloh, I just want to ask again, with this Kush, we don't carry people in the take if it can lead to mental health.
Yeah. Because we take substance, it can affect certain areas in our brain. For example, we get the area of what we call executive functions. We did that So the drug, this drug that now they go compete with the chemicals in the brain, what we talk about, we call neurotransmitters. So if that the neurotransmitters, then they for regulate all we emotions, we thinking, we feel everything about it. So now this drug now it can overpower the neurotransmitters there. So now it is less. So instead of the neurotransmitters for able to regulate how we think or feel or act, the drug now they go take charge now. It mask them. So it lead to mental health conditions there.
So as a medical person, what's in this drug? Because so they Kush, then they mix out this, some even let's say diamond bone self. I mean, how true can they be? Because the one that have not been done, then most of them the body then go down and dig them up. So what's in this Kush as an expert?
Yeah, Kush for me na a concoction of different things there. Yeah, mixtures of different things there. We're very poisonous. Danger for the human body. Yeah.
What's in the cause? They see most of them people in the way they take on the body and they swell, so foods and the worst and dirty, then the weak, they sleep by themselves. Is it that's in there they go take over the executive place, we say?
Yeah, not only the brain, but even other part of the body, like your heart, your lungs, your kidney, your liver, all be affected. Because the chemicals, the way that they use, they're very toxic. Very toxic. For example, you don't see the kidney, you don't work now for pull the waste products. Whereas the liver now for metabolize waste we don't take in. So now, if that chemical we don't take toxic, poisonous, it will damage your kidney, your liver, where they lead to the things that they will say.
So when are the challenge? This don't kind already into other mental issue like the psychiatric home, then the Kush self don't kind inside now. When are the challenge on the face?
It's a huge challenge. Huge challenges. Manpower is one. Imagine we only get 17 mental health nurses there. For the whole nation. Then I would say now with two now I'm a Sierra Leonean psychiatrist.
Okay.
But I mean more day into clinicals.
All right.
Then we'll get to the two consultants and Nigerians with based on the hospital. So we get issue of manpower. We get issue of infrastructure, because imagine now only one psych hospital we get, and drug treatment and rehabilitation center I would say now just one we get.
Okay.
Not the psych hospital. What's it treatment? I mean treatments for drug addicts, proper one. Yeah, we just launched 2 years ago, 2 weeks ago or so.
Okay.
But we got other one at Hastings, where it's like where they support.
All right.
Yes. But we'll get issue again of medication, because for treat somebody when an addict, you need some particular medications, especially if they're into overdose.
Okay.
You need medicine for counter the effect today. Those ones are not available.
All right, so we hope the producer going to show the pictures and the bargain about the recent place where they open, how that place they come about, and what side that place they did, and we're not the facility we get. Because see, in new, the one problem about Sierra Leone is we can see in new, it starts, it clean, it descends, but within 3 months, 6 months just now, it's a different stuff. So, all the open day, how we come about, and just tell me about this place, so to see.
Yeah, so this place come about a collaborative effort between the Ministry of Health, ECOWAS, and partners in health.
Okay.
Yes, ECOWAS provides some funds. You know one thing, where the donors that they support, they can always tag also or task the government for
their own. Give their own.
Yes, so ECOWAS we say government forgive 15%.
All right.
It can be any form.
Okay.
It can be in terms of human resource, any form.
Place,
yes. So governments play a role. Their partners in health also come in. So now that they bring about this whole drug treatment and rehabilitation center.
Okay. I believe say must get a timeline for say within this month and this month the fund would then now that time they go run for. So it will therefore be taken over by Sierra Leoneans, or it will continue for the with ECOWAS and partners in health and well.
No, the funds where they give now for refurbished damaged building where within the hospital.
Okay.
Paul one, I wish I before don't sell you that picture then make it show up. What's it damage? Damage place. So other funds they now ECOWAS a contract a construction farm na Sierra Leone, we go do them.
Okay.
Yes. Then partners in also because the fund will again not be even enough because that place there it cost over 2 billion euros so which all they said that place right now. ECOWAS give like 600 and something
million.
Yes. All the balance now the ministry and partners in health.
So then get a time frame where this place go on? I talk about 1 year, 2, because funding therefore keep it going.
Yes, so this unit is part of the part of the hospital.
Okay.
Yes, it is part of the hospital and the hospital they under the Ministry of Health.
Okay.
So the Ministry of Health therefore
continue.
They continue.
All right.
In fact, the Ministry of Health already start.
All right.
Yes, ECOWAS now just the infrastructure. No more.
Okay.
Yes, but the day-to-day running all the Ministry of Health.
All right. So this place now for, I mean, people who go come up from the hospital or from out of the hospital?
Well, it depends. One thing for make person go in there, it has to be the decision of the individual where they take the drug.
Okay.
Not to me not get a power there. Or me not you say not get a power
But
there.
that's going to be difficult, Dr. Jalloh, because
Now
last
that
thing me down there, for let somebody where they in drugs decide say yes, I want to go there, it takes, I don't know,
Yes.
at first to me it takes counseling first.
Yes, yeah, I know.
And convincing that it going to be okay.
Yes.
Because, I mean, you get the mindset first, like confide place where a lot of people know like.
Yeah, so now we could get interventions there. We get what we call motivational interview. We get what we call brief intervention. We get psychoeducation.
Yeah.
Those are all psychosocial interventions that we would give to the people that for guide them through the process for come up with that decision day.
People go pay?
No, not free.
Okay.
Not free.
But again, free gets a lot of criteria because not free, everybody go there.
Yeah,
there must be a process.
Yes.
You know?
Now make we can we would assess the individual. If you fit for good, then if you don't make up your mind for change, because we get to what we call the motivational interview. We want about stage.
Yeah.
Like pre-contemplation, contemplation, action, all that now. That action now you the individual. Now you for get that decision there. So if you don't make up your mind, say yes, through with psychoeducation, we don't you look at the risk we involve if you take the drugs, the effect will they get on you, your family, the community, the nation as a whole. We would all try for educate you, saying that this, for me, see the need for left, they say yes, doctor. Yes, I want left this drug.
Okay.
I want change. Help me. That trainer will come in and say you could. You don't come in. But again, just like I said, the hospital, like teaching hospital.
Okay.
We go for maintain standards. Standard of a teaching hospital. It has to be evidence based and international best practice.
Okay.
Yes. Now that make we say, anybody one way or another. It has to be the decision of the individual. We just there for support you throughout. In terms of the way say the person don't know what to do, I remember we are to call detox.
Okay.
We detox you. We people they call flushing. We detox you. Then during the detox or after the detox, we can engage you now.
All right.
For see if you're able.
And all that are
for
free.
Change. Not free, yes, not free.
Okay. All right. Thank you very much. We'll ramp up in maybe 2 minutes. But before that, again, Doctor, what's I take about? I don't go side away. When I know I'm calling him, I go around Ascension Town, one big place side in the worship, then sit and they help people out. Push past it and give them heavy chains on their foods, their arm. And I mean, I don't dare hear that than they happen in other places. What do you think about that?
It's a big challenge. Just like I say, why make them be the chain people than before in the hospital? But again, we for learn for know we limitations. You know, say you not get us the skill, the knowledge for handle such people. Why you go keep them? The hospital there. Yes, if not for counseling, yes, we want the religious body, the faith-based organization from also help we. Because now is that a multi-sectoral approach we use. The religious people, traditional healers, community people there for come on board for help we.
Okay.
But know your limitations. Not abuse that person in rights, in human rights. Like crime. So now what currently the task force they do is that they engage the people there for try to get a knowledge for no say this what they do wrong.
Okay. I can also get people them sometimes maybe other people them like you mentioned religiously go get their own take, but making say from the common sense, then say I guess it's a medical issue but not prayer. I get somebody who go argue say because you go pray for that person there, but medically like I say if you don't flush and force and get the thing out of get counseling. You think say you go walk lay, the one who go say, now for pray for no more pray for them, pray. You think say prayer go solve issues with mental issues?
Well, just like I say, this about psychosocial model, we need it also for help way. Because you know say now the first point of call we supposed to get the problem there, now to the traditional healers or the churches or the mosques. So now that make currently we engage them.
So as an expert, what's will be the first point of call where people get a issue? Like
people hospitals, medical. Go seek first medical and see what thing will be the outcome.
Okay.
Yeah.
All right. Thank you very much, Dr. Jalloh. I appreciate where you came and the family and hot seat. Me and Mama Jalloh, truly DJ. Basically talk about the work way Dr. Jalloh they do. Like I say, the whole country now almost they win where they do their work here.
Currently, now we 2 psychiatrists.
For 8 million people.
They will get 7 young doctors where they train for become psychiatrists.
So for now, 2 know about because then they train. So a whole country, just 2.
Yes.
When I don't suggest to government for get more people, or is it that more people they get that fear away, you beats down and go into the profession? For say no one deal with people away, get mental issue and that kind of stuff?
If we at the service providers there, they're even stigmatized we also. Yeah. You talk like
say,
we talk, say, ah, but una kisuna komot. Yes. Even people that we out for no better, there is stigmatized with.
Again, that's now one big problem in Sierra Leone in society. Even some people can not go through Dandy, but stigma can make them go back to Dandy.
Yes, yes, yeah. Stigma. Stigma, in fact, now the main challenge, the main barrier to care. Is the main barrier to care, stigma.
All right. So your message to everybody who they watch and listen to you all over the world on different platforms, on TV, listen to you on radio, social media, we get maybe the experience mental issue or get mental issue or they're on drugs or they're on kush. Talk to them now.
Yes, so mi famule unado listen to it, we don't discuss. I just want for me to know say we possibly get a mental health condition, not to the end of that person in life, or for make that person able to contribute to society. What we need now, we support. Watch your neighbor, watch your picking at house, watch your workmates. If you see say how it be the produced in our workplace, or when be make meet and talk, that person they stop. Reach out to them for make you know waiting and problem. Then I just want for me to know say mental health conditions are treatable. We're able to treat you and function just like how me they function. So you function well. We get so many big people there, we get mental health conditions where they work in high offices there, not only in Sierra Leone but worldwide. Once you take your medicine, you will be okay. We will counsel you, give you psychotherapy, and talk to you. No wait till water pass Gary. It's just like hypertension or diabetes. If you come early with high blood pressure, we the doctors we are able to prevent heart attack, stroke, that big hearts. We're able to prevent. It's the same thing with mental health conditions there. If you come early, we're able to prevent so many consequences there. We're able to make you function well in society.
Okay.
The hospital day, we're there for Savuna, una come, we're able to help una. Thank you.
All right, God bless you. In maybe a few seconds, with the area about addiction. What thing will stop addiction? Just a few seconds, I'll wrap up.
Addiction, the main treatment is prevention.
Okay. How you prevent that?
Different types, we have primary, secondary, and tertiary. The primary prevention, Nahim for embark on. That is, for make people not even start for take the drugs.
Okay.
Because drug, which is starter, you become hooked.
So why we don't start already?
Like also don't starter, we're able to screen you, this secondary aspect, for screen you, for assess you, and try for support you.
All right.
But the one that we don't start, will become chronic. That is difficult. It's difficult.
Okay.
Yeah.
All right, with that plan, thank you, Famble. Tell Dr. Jalloh, plan, thank you. And you out there, pick some sense out of the nonsense. This is a hot seat. With that, me and Mama Jalloh is truly DJ.